Hello, good morning. Anybody online? Let's just... It's quite bright and sunny now. Earlier there was a bit of a storm. That seems to be better. Hello. Hello, welcome. Let's do a sound check. Can you hear me all right? Can you see me all right? Hello. Welcome. Can we check? Can we do a sound check? Can you hear me all right? Good. Just wait for a few more seconds, or a few more people to join us. We were trying out different filters for this. It turned out that sometimes the picture is not so good anyway, so we'll just stick to basic thing, I think. Hello. Right. Okay. Let's just go in a couple of minutes past 10:30. We can get started. I hope you can hear me and see me well. Now, I've talked about this subject before. You know, who is responsible for your health? But sometimes I feel that I can't assume that because I mentioned something some years ago that everybody knows about it, right? So constant repetition, it's good. You know? Sometimes to change a habit, you have to keep doing it again and again, and before it becomes a bit of a habit. And even your mindset, you know, some people argue that maybe you have to do it at least for 21 days. But then, you know, a lot of times you listen to something, after that, you've forgotten what it is about, really. Anyway, so I have been concerned with the COVID situation, and with so many thousands of cases every day, especially in Selangor and KL, that hospitals are overflowing with patients, and you know, government is setting up new places and new facilities. But some of these places are not really proper hospitals, right? You know, they only provide basic care for people who are supposed to be not so sick. But nowadays, of course, if you're not so sick, you don't have to go to hospital at all, right? Even though you are diagnosed to have COVID. Anyway, so we can assume that when you fall sick, somebody will take care of you. Can you do sound check again? And can people hear me all right? How is the sound situation? Is that better? Okay, so you can hear me all right then. Hello. Now, so I would say that, hello, good morning. You can hear me okay? Oh, thank you. Yeah, right. This internet is a wonderful thing. It can be anywhere. I could be talking to you next door. Yeah. Anyway, so well, we hope that if you fall sick, somebody, your doctor or hospital, will take care of you, right? You may or may not have insurance and so on. Right? Unfortunately, this COVID situation has changed a lot of the situation elsewhere as well, right? That because hospitals are filled with all these patients, and there's just no room, and let alone maybe stuffing is a bit limited as well. So anyway, now, isn't it better to not get sick at all, if you can? So we say, oh, okay, like we have vaccinations, so we hope that the vaccinations will control everything. Yeah? But vaccines help to some extent. Unfortunately, the effectiveness of vaccine still depends on your body's ability, on your health, really, yeah? Because whichever vaccine it is designed to stimulate the immune system. So, if you say the cells are not active anyway, and they're like trying to flog a dead horse or sick horse, you will not get it going. So your body is not able to mount an immune reaction to the vaccine. Then it's not going to give you a lot of protection. And this is part and parcel of the whole problem. So we, at the moment, we talk about COVID-19. But if you look at any other diseases, so-called modern-day degenerative diseases, say heart disease and so on. So when you get sick, you come to the hospital, and a lot of times, hello, good morning, that the doctor would do the tests, and most times, if there's a blocked coronary artery, the doctor would open it up and put a stent in, and then you enter into a different phase with different problems, different risks as well, because whatever is in there can still get blocked. Whereas before, if you didn't have anything in there, of course there's still a possibility sometimes that say the artery is 90% blocked, there's still 10% left. So the doctor open it up and then put a stent in, and this stent is at risk of sudden blockage, right? So if it blocks off, hey, good morning. If it blocks off, then you're worse off because even your 10% is gone, right? So what I'm saying is that we know, and I've been talking about this for a long time, that what is contributing to all these diseases and the deterioration in our health, and this applies to anybody in the world, not just Malaysia now, like it used to be US, or India, right? The COVID cases, there's so many of them. Right? So for Malaysia, we recently passed the 1 million mark, and for a country with just 33 million population, that's big. Anyway, so my view is that there is something in our environment, especially in our diet, right, which is causing all this stuff, right, so that we're liable to get all these diseases and infections, which is part of it, right? So now, so what is it that's causing it? And I go on and on about this thing, and some people say, oh, now he's always talking about oil. It is the oil, stupid. So if you do not know what I'm talking about, maybe you can look back and see what what I said recently. Because like just over a year ago, right, at the beginning of the COVID pandemic, I did a long lecture on how our nutrition, our eating, can affect our susceptibility to develop COVID infections, right? And I even published a book on Amazon about this thing. So something is damaging our cells, that will include our immune system. Right? So our ability to maintain the integrity of our cells and just overall health is important. Not just for heart disease, but also a fight against our body to fall sick, right? And when something from outside invade our body. So in this case, it's a virus. So now, so what is it? What's about oil anyway? So my view is, and I haven't changed anything, right? The damaged polyunsaturated fat and oil, which contributes to the damage in our cellular metabolism, right? So that our cell cannot function properly. So in the case of heart disease, because of the damage, then the body uses cholesterol to repair the damage, and thus the artery becomes blocked. So in the case of our susceptibility to infection, the damage to our cellular mechanism means that our immune system is not able to count a good reaction right from the beginning. Right? And that's why we always know all along in this COVID pandemic that people with so-called comorbidities, right, are at higher risk of getting the disease and dying from it. So what are these comorbidities? Yeah, people with heart disease, with diabetes, with high blood pressure, right? And when people get that stage, it is because of the damage to the immune system, right? To the cellular metabolism. Anyway, so we'll come to the scenario where where everybody in the world has been exposed to this problem, the damage to our cellular metabolism. So we're all at risk. And so when this virus comes out, it's supposed to be a new virus, so it can infect people anywhere around the world. And then, some people recover, some people die, and we build some form of immunity. And now with vaccines, that we hope that we can cover this, right? But of course, the viruses do not stay static, right? So they will change, and if there are more of them around, the greater the chance for them to change, and we call this mutation, and that's for different variants. Right? So we're now using all kinds of letters for all these, the delta, lambda, all kinds of things. So it is important that we take care of our own health, right? And especially with regard to your usage of the oil, plus other things. Unfortunately, the oil business is quite difficult to overcome because every single cell in the body has this oil as a cell membrane, right? So if it is damaged, it stays in the system for a long, long time. So, and what we call the half-life is 500 days, right? So that means that it takes a long, long, long time for our body to get rid of it. And as long as this thing is persistent in the body is always at risk of developing problems. Most doctors know about this inflammatory situation in our body, right? So this thing is happening all the time. So the same people that are at risk of developing heart disease, diabetes, high blood pressure are at risk of developing infections, because the underlying mechanism, that is the damage to our cellular metabolism, is still there and is so prevalent anywhere around the world, right? So now, right, okay. Now, in terms of oil, like that, Joey was asking whether coconut oil, I say if you must use oil, coconut oil is relative, right? Because it's stable. So, because when saturated fat is heated up again and again, there can still be some damage, but it's not so critical, What the problem mainly is with the polyunsaturated, right? This is what we call the essential fatty acid. Anyway, so it is important, therefore, that first we take care of our diet, especially with regard to oil. But because this thing has been going on for so many years in anybody, right? So it is important also we take steps to overcome this stuff that is going on in the body. So in this case, it's a good start to take care of the oil and eliminate damaged oil as much as possible. But it is not going to eliminate and get rid of all the bad stuff that you have accumulated in the body. That's why we need all the anti-inflammatory stuff that we can get at. Right? So healthy diet, that means taking more fruits and vegetables and so on, would be useful in that way, because all this will have the polyphenols, this stuff from the fruits and the vegetables, and all the vitamins and minerals and so on. So this would in some way reduce the amount of inflammation that is ongoing in the body. Right? You, of course, provided you do not add to the inflammation. Right? If the fire is burning already, so now all this anti-inflammatory stuff that you take into the body will try to reduce the fire. Right? But then if you pour more oil, literally speaking, making it worse, then it will never win battle. So anyway, because of the situation, and anybody with comorbidity are in this kind of situation, there's a lot of stuff that's not right in the body, we need additional help, right? So additional help in terms of supplements and other natural products that is available in the market. Right? So in this situation, we talk about the beneficial effect and healing effect of the far infrared rays, which we can just wear, something that we can just wear to protect our body, and also natural products that can improve our immune system, and also good for our circulations and so on. Right? So we will cover this individually every Monday, Wednesday, and Friday afternoon at 3:30. So, if you have any questions and queries about this thing, then do get in touch and ask us, and we hope to answer them for you. Right? Now, as much as I want to say at this stage, if you find this helpful, do like and share this, and hope to see you soon at another occasion. Thank you for joining us today. Goodbye.